Hi, and thank you for purchasing a CES Ultra unit. I'm Dr. Adrian Larsen, and in this video, we're going to talk about how you can get the most from your CES Ultra. I'd like to start by telling you that this is a device I've personally used for years. I've used it in my family, I've used it with patients, I've had wonderful success, and I'm very excited that you're going to experience all the benefits of CES Ultra. Whether you're using it for anxiety, for insomnia, or just for general overall health, there's a lot to be gained from learning how to use it and get the most from it. So a couple of points to start with. First of all, I want you to realize that the CES Ultra has a cumulative effect. Therefore, if you try it once and you don't see tremendous results, although you might on the very first use, but if you don't see all the results you're looking for on the first use, that's completely normal. It can take up to 3, even 4 weeks to get the full effect. So we encourage you to use it consistently, to use it daily, and to use it as indicated and see how your results start to improve and get better and better. Of course, we always love to hear about those miraculous cases where people get instant results, and that may be you as well. But if not, don't give up. Keep using the device. Give it some time to help your brain adapt. Next, let's talk about when and how you should use your CES Ultra. If you're using it for insomnia, one of the temptations might be to use it right before bed in hopes that it's going to help you sleep, or even to try to use it during a bout of insomnia when you're trying to go to sleep. Although that may be effective, the more effective and recommended approach is to actually use the CES Ultra several hours before you're going to go to bed. That's when you'll have the maximum effect. So if you have a session with your CES Ultra, for example, right after your evening meal, that's the optimal time if you're working with insomnia. Optionally, you can also treat first thing in the morning and do both. One in the morning, one in the evening. 2 30-minute sessions tend to get very nice results. You can do something similar in the case of anxiety. Time of day isn't necessarily as important for anxiety, and you are certainly welcome to use CES Ultra while you are doing other activities like watching TV, reading, even sitting at your desk working. Although we find that it's best if you can do something that's very relaxing, give yourself a chance to unplug, to calm down, and let it have its maximum effect. The next thing I'd like to talk about is the gradual introduction of CES. So when you first start using the device, it's the best practice to start with a relatively low intensity on the intensity dial and to use shorter sessions. Now you have the choice of 30 minutes, 45 minutes, or continuous. Start with a single 30-minute session per day on a rather low intensity, just to where you can start to feel the tingling, and then you can work up from there. You can set the intensity where it's comfortable, and as you gradually work up over the course of a couple of weeks, you can increase the intensity to keep it at a comfortable level. To have a maximum effect, you don't have to have maximum intensity. There's no reason that you need to turn it up to full. And the other thing to keep in mind is that when you set it for, say, 30 minutes on the timer, it will treat for the entire 30 minutes. And at the end of the 30 minutes, it will stop treating. However, the light will continue to flash on the CES unit, telling you that it has finished treating and you now need to take the dial and turn it to the off position where it clicks. Otherwise, if you just leave it sitting there on and waiting, then it'll eventually drain the battery. So when it reaches the end of its timer and it stops treating and you feel the treatment stop, then just go ahead, turn it to the off position, and it's ready to start for the next time you're going to treat. One other thing to note, by the way, is that not everybody will feel the treatment with the ear clips or with the electrodes. Some people are more sensitive, or their skin is more conductive, and therefore they can feel the electricity tingle a little more. Other people are less so. And so if you're not feeling the treatment, even with the intensity turned up, it doesn't mean you're not being treated. It's still working and it's still having an effect. Now, let's talk about contraindications. There are certain situations in which you should not use the CES Ultra. The most notable is if you have an implanted electronic device, a pacemaker, a cardiac defibrillator, for example. Anytime you have an implanted electronic device, then you can't use electrical stimulation on the body. because it could interfere. Also, in the cases of epilepsy or seizure disorders, pregnancy, then there are special precautions to be taken. So make sure that you read the manual and pay careful attention to the warnings and contraindications section to make sure that you're using it safely, correctly, and with maximum benefit. Another question we get asked frequently is, can I use CES Ultra if I'm also using another treatment for anxiety or for insomnia? Perhaps you're taking meds. And the answer is yes, but you need to consult with your prescribing physician and make sure that you work in conjunction with your provider. You may find, for example, that using CES Ultra in conjunction with medication enhances the effect of the medication, and you may end up needing to lower the dose. But never make any changes to your medication without consulting your practitioner and making sure that you're doing it properly and under supervision. Now that we've talked a little bit about home use for yourself or your family, I'd like to just address a few remarks to the practitioners out there who are using this in a clinical setting. First of all, that's wonderful. That's a great thing to do. And CES Ultra, CES stimulation in general, can be very effective when combined with other modalities, whether you're doing acupuncture, auriculotherapy, herbs, whatever it is that you're using in your clinic. Using CES Ultra in conjunction can have a synergistic effect and be a very effective thing to do. Also, because the CES Ultra works by helping the brain normalize its own brain chemistry without artificial stimulation or artificial chemical enhancements and so on, it can be safe and effective when combined with other modalities. You don't have to worry about interactions, for example, with something else that you may be doing. Now, having said that, there's a question we often get, and that is, so how effective is, say, one 30-minute session per week going to be while my patient is on the table receiving acupuncture or whatever other modality? And the answer is, of course, that's not the ideal. Ideally, they could be doing a session every day, but it is still beneficial and it is still has an enhancing effect on what you're doing. Ultimately, our best recommendation is, as a practitioner, to have CES units that you make available to your patients. You can do that by selling them in your clinic. You can rent them for home use, or you can even have loaner units that your patients take home, use at home, under your direction, under your supervision, and get the results that they're looking for. To that end, we do offer wholesale programs for licensed practitioners where you can purchase units in bulk at a wholesale price and then resell them in your clinic or rent them, loan them out, whatever is going to work for you. Most of all, we want to make sure that your patients are getting the maximum benefit that they can get from CES, which is wonderful because it's affordable, it's safe, it's natural, it's highly effective, it's non-habit forming, and it may be the thing that makes a huge difference in your patients' lives. So I hope you found a few of these tips helpful. Most of all, I hope that you're going to get the results you're looking for and that you'll find that CES Ultra is one of the best investments you've ever made. In this video, we're going to take a look at the CES Ultra unit, look at all of its parts and pieces, and how to properly set it up and use it. So to begin, let's take a look at everything that comes with the kit. We have the CES Ultra unit, the battery, 2 sets of lead wires, a set of ear clips designed to connect to the ears, and then a small squeeze bottle designed for saline solution that can be used with the ear clips. You'll also find there's a manual and a set of electrodes, stick-on electrodes, that can be used instead of the ear clips, and we'll demonstrate how to use each of those. Remember to look at and read the manual for important safety information and use instructions. Next, we'll talk about how to install the battery in the CES Ultra unit. When you look at the bottom side of the unit, you'll see that there is a door with an arrow on either end, indicating that the door can slide in either direction to open. So with a little thumb pressure, you slide it, it opens very easily, and you can completely remove the door. And then you can reach inside and you can pull out the battery clip and the white ribbon. Both of them need to be outside the unit when you install the battery. Next, you take the battery and you clip it to the clip, paying careful attention to match up the correct connectors in the correct way. If you try to connect it backwards, it won't snap in and it won't connect. So when you've properly aligned it, then with a little pressure, snap, and then the two battery connections are made. And then with the ribbon still outside the CES Ultra unit, you can carefully lower the battery into place, making sure to tuck the connector in and making sure that the battery seats all the way inside. From there then, you can slide the battery door back in place and it's closed up and ready to use. You can verify that the battery is inserted properly and connected properly because when you turn on the unit, you will get the lights indicating that the unit is ready to operate. To remove the battery when the battery needs to be changed, simply turn the unit upside down, slide the battery door out of the way, and then use the white ribbon to pull the battery up out of the battery tray. Disconnect it by pulling the two clips loose, and you're ready to change the battery. Next, let's talk about setting up the leads. Each set of leads comes with the end that goes into the CES unit. It's just the small plug, and there's a little cutout notch in the plug that will only allow the plug to be inserted in one direction. So you just push that in, push it in firmly till it's all the way seated, and that's how you install it. At the other end, you have these two pin clips. These pin clips can be used either with the ear clips or with the sticky electrodes. Either way, they just slide on. So in this case, for the ear clips, you're looking for the little hole right there, and the ear clip slides in just like that. The other one slides right in, and these are ready to be connected to the ears and the unit to be operated. When you slide the pin into the ear clip, you might find that some ear clips are loose and the pin comes out easily, which means that during use the pin may come out of the ear clip. Even if they start out tight, over the course of use sometimes they may tend to loosen, and this is perfectly okay and it's easily remedied. Let me show you the difference. Here is one that is properly tight. It takes quite a bit more force to insert the pin clip, and it takes quite a bit of force to remove the pin clip. And that means that you'll have a secure connection. So since this ear clip is actually a little bit loose, it's quite easy to tighten up and to make it a snug fit, and I'll demonstrate how to do that. In this case, I'm just going to use a small screwdriver. Any kind of a small instrument will work. And I'm going to open the ear clip, and I'm going to hold it open right here with my thumb. And then I'm going to reach in with my little instrument, and I'm going to push right here. There's a little rubber area, and I'm going to gently push right there. Just a couple of pushes like that. I'm not pushing hard at all. It doesn't take a lot of pressure. And that's that. Once I've reseated the connector, then when I go to put these in, they become much tighter, much more of a snug fit. Now let's talk about how to use your CES Ultra unit with the adhesive pads. First, you'll want to pull off the ear clips if they're on, and they just pull straight off of the pin tips of the electrical cable. And then you'll choose a set of pads, and the pin connectors just push directly in like that to connect to the pads. Make sure you push them in and seat them all the way. Then peel the pads off the backing, and you want to save the piece of plastic backing so that you can store the pads there when you're not using them. For the placement of the pads, there's information that comes with your unit that shows where the pad should be placed, and it's important to notice that it's placed under the earlobe and slightly behind. It's not placed forward onto the neck underneath the jaw. That would be bad placement, and it's not going to have a proper effect there. So make sure that you're under the earlobe and slightly behind the earlobe, close to the tip of the bone called the mastoid process. When you've got the pads placed properly, then turn on the machine, set the intensity where it's comfortable, set the timer where you want it, and it's ready to treat. A couple of tips for using these pads. If the pads start to lose their stick, they can be gently washed with water, and they can be moistened with water before they're stored to help keep them moist, and store them by sticking them back to the plastic that they came on rather than sticking them together or sticking them somewhere else. If you do that and take good care of them, it'll prolong the life of the pads. Ultimately, though, they will wear out. They'll no longer adhere properly, and they're designed to do that. When that happens, then it's time to just use a new set of pads. You can use any pads that are designed for these sorts of electrical devices. They're commonly seen on TENS machines, and they commonly all have the same pin connector. So you can buy replacement pads, plug them in, and you're ready to go. Thank you for purchasing the CES Ultra unit, the premier cranial electrical stimulation device on the market. Should you have any questions or need further assistance, please feel free to reach out to us for help. And we hope you get